was really hard for, I guess, me and the other junior doctors that were part of the class action to actually say, I know this is how it was done and this is how the hospital treated you 20, 30, 40 years ago, but that's not the way we are going to accept it for us. Currently, my HECS debt is sitting at $180,000. So, yes, I am privileged that I'm a doctor, but I'm also in debt.
Hi, I'm Tessa Arcilia. In Choices and Chances, I use my own style of interviewing, honed through decades as an international news presenter and correspondent, to delve into a new topic each week and interview some of the most inspiring people in the world. Life is a series of choices that give us chances to live our best lives. My goal is to turn the wisdom of people I talk to and lessons from my own experiences into ideas you can use. So if you'd like to be inspired by others' stories, hit the subscribe button and join the community. Welcome to this episode of Choices and Chances. Now, today's guest is someone who's been in the news quite a bit, especially in the last few months here in Australia, and she had gained recognition for something she had done. Now, in 2020, Dr. Amireh Fakhouri became the lead plaintiff in a class action that alleged that New South Wales Health here in Australia had underpaid junior doctors, and this covered a specific period of time. So we're going to talk to her about why she did what she did. Why did she stand up and step up and become the face of that class action? Dr. Amireh Fakhouri, thanks so much for joining us and for giving us some of your time.
Thanks, Tessa. Yes, I'm really happy to be on your podcast.
Thank you. So, Amireh, first of all, I'm really curious about how you felt, because on the 12th of August, there was a decision from the Supreme Court of New South Wales that approved that settlement of the class action of junior doctors. And I think the amount is 299.8 million Australian dollars. How did that feel when that came out?
It was great. It was a big relief for me that we finally reached the end, the light at the end of the tunnel. No one likes to go through anything legal, especially doctors who are really busy and really worried about their careers. So for me, the settlement was just really the light at the end of the tunnel, in order for me to just take a breather and actually realize it's done and I've achieved what I wanted to achieve, which is the payment for the junior doctors, which isn't necessarily the actual money, but it's a recognition that we've actually done the work, and we need to be rewarded for what we've actually done.
Yeah, and so for people who might not know about that class action, can you just briefly tell us what was it that you were fighting for?
Yeah, so as a junior doctor, we are interns and residents working in a public hospital. We do rotations where we have actual set shift work, which is considered rostered time. And then we also do the overtime that a lot of the time is not paid, and that's considered unpaid, unrostered overtime. The fact that it's unrostered means we won't get paid for it because we're not actually rostered to do the overtime. And being a junior doctor in a busy public hospital, you're often working overtime many hours a week, on average 4 to 5 hours a week, depending what rotation you're doing, a bit more maybe for surgical, a bit less for emergency department. But because you're not rostered to do that overtime, we ultimately don't get paid for it. And we've always had issues when we've actually applied for the overtime. We either get shut down by the head of department or our supervisors and say, this, we can't sign this, and just full stop, move on. And other times it actually reflects negatively on our career, because as a doctor, who's new in the millenniums, compared to the doctors that have been doctors for the last 50 or 60 years, their reply was always, this is what we've done, and this is how you do it, and this is how it's going to continue. So it was really hard for, I guess, me and the other junior doctors that were part of the class action to actually say, I know this is how it was done, and this is how the hospital treated you 20, 30, 40 years ago, but that's not the way we are going to accept it for us. And it was taking that stance and actually going ahead with it. And I guess despite all the obstacles and challenges that were put ahead of us from the New South Wales Health Department, we just kept going and just kept telling the truth. And when you tell the truth, there's justice at the end of it.
When you say that, the some older people might say, well, this is how it's always been done, and this is the way it is, and there could be resistance coming from there. How do you deal with that? And I imagine if you talk to people who agree with your stance, okay, and I think there are more and more people who are recognizing the need for some sort of balance in work and life and taking care of one's health. So how did you deal with that? Because it is very entrenched in careers like yours and like mine.
Yeah, I just basically said times have changed. It is what it is. Times have changed, and we, as doctors, we have now become advocates as well, not just for our patients but for ourselves. And that's a big step for us. And it is what it is. But times have changed, and we should be respected for our careers, for our the jobs that we have, and the hard work that we actually do. A lot of older, older generation doctors would say, you know, um, you're not getting enough clinical exposure because now you're working considered safe hours where it's only 38 hours a week. It's going to take you longer to have the experience that we used to have in a short amount of time. Um, but just going back on your point about how they responded when we said when they used to say this is how we did it, I think it's really important for us as doctors and junior doctors to say, I understand this is how you did it, but this is how it needs to be done now without having to justify it. Because in other careers, you don't have to justify it. So why in medicine do we have to justify why we should work safe work hours, why we should be paid for the work that we do? It's common sense.
Full disclosure, I'm the partner of a physician, so I understand your career and your world. When there is a certain view from some in the community that, oh, doctors are so privileged already, they have they have this career, they're very respected, they make a good income, and so when you demand something like this, it's kind of looked at, and I'm not saying all, and I'm not saying it's common, but there is that assumption that doctors are part of the privileged elite.
Absolutely, and we are. But to get to that point, we've given up and sacrificed a lot. So I'm currently still a GP registrar. I just passed my exams a few months ago. So in February next year, I will fellow, and that's when I will become a full consultant. Now, since I've started my university back in, I think, 2008 or 2009, until now, it's been almost 15 or 16 years that I've dedicated my life to medicine. That's 15 or 16 years where I've had no income or very little income or an intern income. And so I deserve, obviously, to have proper income. And I deserve to have the money that I've worked for. And just to give you some indication, this is kind of, I guess, personal. Currently my HECS debt is sitting at $180,000. So yes, I am privileged that I'm a doctor, but I'm also in debt, and that impacts my ability to own a house, to get a car, because that's always going to be debt on me until I pay it off. So I've had 16 years of very minimal income. Now's my time to make the income, but it doesn't mean I should be taken advantage of for the years that I've worked.
I would like to get deep into why you did it, because as you kind of alluded to earlier on, there was a risk to your career, a risk to your reputation. You would not have known the outcome of this class action. So why did you do it? And was there a tipping point, a moment where you, okay, I'm going to do this. I'm going to lead this. I'm going to be the face of the junior doctors and stand up for my peers?
I guess there wasn't. It was all kind of a bit of a coincidence. I received an email from the lawyers that they've sent out to many doctors saying, we're doing this class action and we just want to interview for the overtime that you did. And I did interview with Hayden Stevens, one of the lawyers, and he did ask me, do you have any evidence of, these hours that you're saying you've worked overtime? And I remember going back, spending hours looking through text messages on WhatsApp and emails, trolling through, a few years of emails, searching overtime in the search field. And I sent him everything that I had, and he actually said, oh, Amireh, you've provided us, you're the only one that's provided us with this much evidence. And we all know, with evidence, a paper trail is evidence that's sufficient in court. So he asked me, would you be the lead of the class action? And for a minute, I was like, yes, of course I'll do it. And then he said, okay, that was a very quick response. I didn't expect that. But he's like, sleep on it, have a chat to your family, etc. So at that point in time, I was just newly in the GP training program. I was on maternity leave and I was living in Victoria. So I wasn't in the public hospital system and I wasn't living in New South Wales. So I guess I didn't have that risk to my career as my other colleagues in New South Wales would. And most of them at that time would have been in a training program for physician training or GP or surgical training. So I guess I had less to risk, but I still had a career that I would risk. And so I just spoke to my family, and I remember my husband saying to me, "Why are you asking me this? I know what you know what you're going to do, and I'm not going to change that. So, so just do what you want to do, and I support you." And I guess that's he knows when I see something that is unjust or inequitable that I always speak out and I don't stay silent. I guess that kind of comes down to my cultural heritage. Being Palestinian, we've kind of had to be resilient and resist over the years. Um, so yeah, that's how it all came about. And then I agreed to be the lead applicant for the class action. I didn't anticipate it being this long, taking 4 years. Obviously, lots of papers and emails and meetings I've had with the lawyers. But we eventually got there, and I remember the mediation on the day. Once we agreed, it was just a big sign of relief that we've actually got there and got to the end. And like I've always said, it's not about the money. We don't get a big lump sum as doctors for the back pay, but it's just about the cultural change that we're going to push for in hospitals, because it's not acceptable anymore to, I guess, just take advantage of doctors because of just our natural personalities that we tend to give and we're caring. But we should also be respected and respected for the work that we do.
4 years is a long time. Was it hard during that time, or was it something that was just happening in the background? You were involved, but so what was that like? What was that process like?
Yeah, look, a lot of it was happening in the background, like lawyers doing a lot of the paperwork and a lot of trolling papers and pay slips. But I did have meetings, and meetings did go on for a few hours sometimes. The biggest, one of the longest meetings was for completing my affidavit that we've, I guess, went over probably 20 or 30 times, read and I've signed. Yeah, so I guess it was just time. Initially, when I was on maternity leave, it was okay. I had the flexibility of time. But once I went back to training, it was trying to fit in those meetings, the few trips to Sydney, around my work, around my family, obviously sacrificing family time, because most of the meetings I would be doing on my days off, which my kids would be home with me, where I should be, spending the time with them. I'm often in meetings, having them in my lap, speaking to the lawyers. So I guess it was a sacrifice mainly time-wise.
You mentioned it, your cultural background. So, people's decisions, I think, are shaped by life experiences and circumstances. And, you have lessons that guide you in your decision making. Do you feel that way as well? And that your background really had a big impact on the way you made decisions in life?
Yeah, I definitely do. Yes. I guess we've moved a lot throughout our life. Like I've personally probably lived in about shy of 40 houses, rental homes in my lifetime since I've moved from Jordan. So I've moved a lot, and I think I've built that resilience to, I guess, I built the resilience to, I guess, keep moving forward and keep fighting. And I think that's definitely shaped me as a person. And obviously, my parents having to move, obviously, the 40 houses since they've moved from, a country, I guess it's just shaped me and ingrained me to be the person I am today.
What was your background? Can you just tell us the journey? How did you get to Australia?
So I'm Palestinian origin. My grandparents fled Palestine and moved to Jordan in the 60s. My parents were born in Palestine but moved to Jordan very young. And I was born in Jordan as well and moved to New Zealand when I was 6. Family couldn't really adjust to the lifestyle in New Zealand. There wasn't much income opportunities for migrants. So we moved to Australia and initially lived in Canberra for a year, and then I settled down in Melbourne, but moved within Melbourne and Sydney for my training.
Your background as coming from a refugee family, um, it's a very specific one, and we talk about this because of what's going on in the world. It's very much front and center of what we consume in the news. And personally, I've covered the Syrian refugee crisis. It was one of the most I think difficult topics I've had to cover. What is your personal experience as someone coming from a refugee family? What is that like, and what impact does that have on you? Is it something that is front and center of your life throughout?
That's good. That's a good question, and I haven't really thought of it. But I guess growing up um, in a country like Australia, I guess refugees who have migrated here, a lot of them feel like they don't belong. Um, but I've had a very different experience. I don't see myself any less than anyone who was born in Australia. I'm just as intelligent. I'm just as passionate about what I do, about my job, about my country, about where I live, looking after my children. So I don't feel like I'm any less than anyone that's actually born in Australia. And I feel like in fact it means I've got a good insight in refugees and the struggles that they face. And as a doctor, that's really important, especially that I work in refugee health as a GP.
What is that work like? What is your day to day, and what do you face with having to, not just from a medical point of view, but having to work with people that have a very, I suppose, difficult background because of the fact that they have come here as refugees?
Yeah, so the clinic I work in is in the western suburbs of Melbourne, and our main cohort of patients are from Myanmar, Burma, and Thailand. Excuse me, Thailand refugee camp, as well as Syria and a few countries in Africa. So they've all come from countries that have suffered from war, and the majority of them have some sort of trauma from war, whether it's physical or psychological. A lot of work that I do is complex medicine. So a lot of these people or refugees haven't had healthcare back in their homes for many years. So they've got all these chronic and complex conditions, genetic conditions that have been untreated for many years. So the medicine is complex, and that's what I love about it. It's not, the traditional mainstream general practice type of presentations. And the other, I guess, the non-clinical aspect that we deal a lot with is all the psychosocial aspects. So in medicine, we look at we have a model of care, which is the biopsychosocial. The biology is kind of the complex medicine that I spoke about, but then the psychosocial are so ingrained into the biology that patients that have post-traumatic stress disorder from the war or certain instances that they've had in their home countries, it impacts their biology. And so it's really hard, I guess, dealing with refugees because you can't isolate the bio from the psycho and the social. So, a normal day I would see anyone anywhere from, someone who's got mental health conditions that are suicidal to someone who's got chest pain, to someone who has chronic hepatitis B, and because they're asymptomatic, they don't feel any pain. They don't understand why they need to take the medication, the antiviral. And a lot of what I do is health literacy and education as why you need to take this medication, why you have to take this medication lifelong, and it's not just to finish the box and move on. So I guess a lot of work that I do with the refugees is health literacy and just going back to basics. This is your liver, this is what the liver does, and this is the virus that damages your liver. And if you don't take this medication, it will kill you. Really basic, I guess, terminology. And for me, it's empowering the individuals or the patients and the refugees to take control of their own health. And for me, I guess being, such a passionate advocate, that's really important. And then obviously advocating for the refugees. I do a lot of advocacy in the background, talking to their schools, talking to employees when they've been unfairly dismissed or been injured at work and have no idea that they've got rights to work cover and what that entails. So it's a very varied job. It is niche that I guess in that fact that is refugee health, but it's very complex.
It's an amazing line of work. I think I already feel just through you how fulfilling that must be. And do you draw from your experience? Because I can see very clearly you've had a very different experience. And people ask me that the same way. My family were economic migrants, and we moved around. My identity, it's a very complex question for me about what my identity is. Same with you, because you've had a positive experience in Australia, but with the refugees you're dealing with, they might not have had the same experience, and also maybe their background or trauma that they've experienced is different. Um, how do you contextualize that for them, and also help them through using your own experience, where you're in a positive position, in a good position? Does that come into play when you try to help them, empower them, not just health wise, but taking control of their lives as well?
Yeah, I guess a lot of the patients that we do get, they're in their 40s and 50s, and although they're young, in Australia considered, 40s and 50s, they're very young. They have lots of chronic and complex and psychological conditions, and it's really hard to kind of empower them and get them to that. I guess it's really hard for them to see the light at the end of the tunnel. Um, they often come to me wanting like some sort of SIG certificate or Centrelink certificate, so they don't go to English school because they're just so burdened of not understanding what the teacher is saying. That they've some majority of them are literate, don't know how to read or write, and then you're putting them in this English school 4 days a week, and it's bringing up lots of trauma, lots of psychological and physical issues, and they often come to me with not wanting to go to school and asking for some sort of certificate. And for me, it's really about education and saying, it's important that you learn English to be able to survive in this country. When I say survive, I don't mean it in a literal meaning, but from a social perspective, be able to go to the shopping centre and buy your groceries, be able to call and book an appointment for whatever service you need. And they a lot of them can't see that the importance of that. And so then I explained to them, like, I was a refugee, and I came, even though I grew up here and I came at a younger age, I managed to become a doctor. I had to move around a lot. I had to sacrifice a lot. But just because I am of refugee background, it doesn't mean I cannot reach my goal. And, for me, it was a passion to be a doctor. I do use my experiences, especially with the younger generation of the refugees that I see. I do empower them to become educated. If it's hard, get some tutoring. Come and ask me. I can write a letter of support for school to offer extra services, extra tutoring for you. If you need supports at work for cultural reasons, whether you need a break to pray, or take time off for certain religious festivals or events, I'm willing to support them, because the only way they will succeed in Australia is if they're integrated in our system and don't feel like an outsider.
Equipping them with the tools to make that decision, to say, yes, I'm going to work hard and do this and do that. I think, yeah, you're right. I think that's the key to them, to integrating. Do you see a lot of success in that?
I've only been working in the clinic for 2 years, so I haven't kind of seen the fruits of my labour, I guess. But there's great examples of refugees. Fatima Payman, who was on the Labor Party, now an independent senator. She was of a refugee migrant background, and she's an independent senator representing Western Australia. So just because you're a refugee, you shouldn't feel any less than any other Australian. It doesn't mean you can't achieve the same or even more than any Australian. And in fact, I feel like we almost work even harder, and we're more passionate and we're more driven, because we've had the experiences in our past that shape us to be today.
Yeah, and I think that speaks to the strength of the individual, to have a narrative that is positive about whatever your past is. We all have baggage from our families and our backgrounds, right? And so when it comes to your identity, when we say who are you, do you have a clear answer to that?
It's funny you ask this, because I actually attended a leadership conference a few weeks ago, and they asked me to go up on stage, and I was one of the organisers, so I was a bit caught off guard. Um, and look into a camera and look at myself in the big PowerPoint screen, and they asked me, who are you? And I was meant to reply, and my reply was, I don't know who I am. I think I know who I am, but I don't know. And I guess it was a very confronting question. We often know who we are by how others perceive us. But I guess it's really hard to know who you are as an individual. It will take a lot of psychology sessions to figure that out. But I guess in terms of who I am, firstly and foremost, I'm a mother. I've got two young children, and I'm a wife. So that's kind of that's I guess my ultimate passion. The other thing is I'm a doctor. I'm a refugee health doctor, and I advocate for inequity and justice. And I've actually published a book on health inequity in Australian paediatric patients. It was published in 2021, and we've I've discussed a lot of inequities that paediatric patients across Australia face, and so I guess that's my passion, and that's who I am. I did recently get the award from the the Australian Medical Association, the Doctors in Training Award for the class action. So I guess I'm a big advocate. I speak up for what I see as right, and I speak up for what I see as speak against what I see as wrong.
And do you have a cultural identity or a mixture of who you are in that sense?
Yeah, so I always say I'm a Palestinian Australian. Whether I say Australian Palestinian or Palestinian Australian, it's just whatever comes out first. It doesn't matter because for me it's a 50-50. I'll always have my deep roots, which are the Palestinian culture, but I'm also Australian. I grew up here. I've got the slang, the Australian accent, and I enjoy playing netball and going to the movies. And although I'm not a big fan of sports, I can't say I like cricket or AFL, but I enjoy netball. So I feel like I'm just as Australian as Palestinian, and that I shouldn't have that distinction between my identity just because of obviously the current climate.
And before I let you go, I'd like to ask some maybe more practical steps for people who are listening about, when you make a decision, something like, should I be the lead in this big case? Should I sacrifice this over that? What helps you make those decisions?
For me, it's my religious background. So I'm Muslim, and a lot of decisions that I make are based on my religion and what I believe is the right thing to do based on what the situation is and what my religion, guides me to. Um, but if I guess moving forward, if it's a decision that you have to make, you obviously have to weigh up the risks and benefits to you, to your family, to your career, but also your values, and your beliefs and morals. Where is your ethical compass? Like which direction would if you had a physical compass and you had a decision to make, where would in your heart your ethical compass um, you know uh, point towards? And I think it's different for every person because everyone has different values and different goals in life. But for me, like I said, it's my religion, and that kind of guides me as to the pathway that I take.
I don't really want to get political, but you mentioned the current climate. As a doctor and as an Australian, Palestinian, and a mix of all these things, how does the just what's going on in the world, play and have an impact or play into your life, or is it just something kind of bigger than all of us at the moment? How would you characterize that?
Yeah, it's this is I guess it's almost a year now,
Mm.
and a lot of doctors here, not necessarily Palestinians, but a lot of doctors are burnt out from what they've seen overseas. I've personally been burnt out from about the 800 and plus healthcare professionals that have been killed in Gaza. Um, I cannot fathom this ever happening in Australia and the world staying silent. So why are we silent? Why is Australia silent? Why are our colleges, like the Australian Medical Association, the Royal College of General Practitioners, why are they silent towards the 800 healthcare workers that have been killed in Gaza? Um, and I obviously I am biased because I am Palestinian, but take that aside. I'm also a doctor, and as a doctor, I have a duty of care, and I've taken an ethical oath that we do no harm, and the Hippocratic oath, and now I've forgotten it.
Yeah.
Do no harm, and value life, and I wouldn't be a doctor, and I wouldn't have these values that I have as a doctor if I was to stay silent about what's happening in Gaza. Not just the civilian population, which 20,000 children have been murdered, but also the healthcare professionals that have been killed. What destruction has this done to the Gazan healthcare system? They basically have no healthcare system left. And I guess as Australians and Australian doctors, how can we help rebuild their healthcare system? On a personal level, everyone is, I guess, in agreement that what is happening overseas in Gaza is not acceptable, especially from a healthcare perspective, like the killing of the doctors and healthcare workers and the destruction of hospitals and healthcare facilities. I cannot see anyone that I've spoken to that says it's fine, I don't worry about it. But the problem is, we know personally, and we understand what's happening, and we don't speak up. That's the problem. So I would have colleagues come up to me and say, this is happening, and how can we help? But under the table or behind the doors, because they're either afraid to speak up because being reprimanded by their workplace, their careers at risk. No one wants to be labelled anti-Semitic, and which it has been thrown around a lot these days. So people are very happy to speak to me on a one-on-one level and say, we're here, we support you, but we just don't want our name out there. And I think for me that being an advocate and doing things that I've done, for example, the class action, I don't understand why that's the case. Like, why can't you speak up for what you see is wrong? And what does that mean you as a person is? And how does that kind of, how does that change your ethical and moral compass? If you're silent on such matters like this, what does that mean you are as a person? And how are you compassionate towards your patients? If you're seeing all this death, but you're not able to advocate and speak up about it. It's really hard not to be political, but I think it's people have to weigh up their risks and benefits about talking about Gaza and what's happening, and no one wants to be left without a job, especially doctors who've worked many years and to get to where they are.
Rounding up this conversation with where we began, the class action, have you seen the cultural change that you're seeking? I know it's just been, it's very recent, but has there been some signs that this is kind of seeping through in the system because it's been a 4-year-long struggle? It's out in the media, you're talking, you're visible. Have there been some changes?
Absolutely, there's been changes. Changes are slow, so it's really hard to change culture in a hospital setting. Within the doctors and also within the HR department and the hospital board. But with the success of this class action being it the largest class action in Australia's history, a very big value of money, and a lot of I guess a lot of feedback has been positive. I haven't had any negative feedback. There's been no negative feedback in the media about the class action. So it is all pointing to the right direction. I've spoken to colleagues on a one-to-one personal level. They said it's easier to get overtime sheets signed, but they're still kind of required to jump through some hoops. So it's in progress. There's a change. Just yesterday in the Canberra Times, there was a class action in ACT against Canberra. Believe it's Canberra Hospital, ACT Health, and that was settled for $31 million. That was by Dr. Tran. And then early in the year was Victoria by Dr. Bolton as well, the class action. So there is There is a change. It's slow, but there's definitely a change, and we just need to keep pushing because it's the right thing. It's the right thing. We're not doing anything wrong. We're working. We're doing the job. So why not be paid for it?
How does that make you feel?
Like I said, I feel relieved that it's over more than happy, I guess, because at the end of the day, I am a doctor and I'm very busy, and it was taking a lot of my time and a lot of family time. So I'm just relieved it's done, and I'm really looking forward to the cultural change, the outcome, in the next 2 years or 5 years and 10 years, and for it to be just a normal process where if you worked overtime, you just put it in your timesheet and it gets automatically approved, and you shouldn't be questioned as to why you're staying back. Doing discharge summaries. Why are you not efficient enough? Maybe you need to manage your time better so you get home on time. And we shouldn't be questioned. We're very intelligent people. I'm pretty sure we don't want to sit around hospital when we could be at home with family or friends. So just being thrown, having questions or comments thrown at us that maybe we're not efficient with our time, or maybe we need to have better time management, was really upsetting by our senior colleagues and HR departments.
It'll be interesting to see how that does trickle through, and we're also looking forward to what you do next. I'm sure you'll be very visible.
Thank you so much for your time.
If you enjoyed this episode, please consider giving us a 5-star rating so others can find the podcast. Thank you for your company, and see you next time.